This is assignment 8.2 for Health 650, Hypertension Prevention through Mindfulness Meditation. This presentation will review the following items. What is hypertension? Chronic stress? What is mindfulness meditation? A program overview, participant expectations, journaling, and lifestyle changes. Hypertension, or high blood pressure, is the most widely experienced chronic disease in the United States, affecting up to 1/3 of American adults. Hypertension is defined as having a blood pressure higher than is expected for age and activity. There is some debate about the threshold for what constitutes hypertension. However, consensus says that systolic blood pressure at or above 130 to 140 millimeters of mercury and diastolic blood pressure at or above 80 to 90 millimeters of mercury is defined as having hypertension. Hypertension does not typically have symptoms or warning signs other than a high blood pressure reading at the doctor's, which means that individuals may not even know that they have high blood pressure until diagnosed by a doctor. Hypertension in itself is detrimental to one's health as it stresses organs such as heart and kidneys. However, hypertension is also a significant risk factor for developing other serious illnesses such as cardiovascular disease, chronic kidney disease, and stroke. There are many contributing factors to developing hypertension. Among the most common contributors are genetic predisposition, lifestyle factors such as unhealthy diet and a lack of physical activity, as well as chronic stress. While there are many actions that can be taken to decrease one's risk for hypertension, managing chronic stress has been shown in studies to reliably lower blood pressure while also decreasing the risks for anxiety, depression, and other chronic health conditions. Chronic stress, one of the risk factors for hypertension, can lead to prolonged activation of the sympathetic nervous system. This causes blood pressure to rise and can be a major factor in the development of hypertension. Studies have shown that there are several ways to cope with chronic stress, decreasing its effects on the body and building resiliency for future stress. Activities such as expressive writing, physical exercise, affirmations, artistic endeavors, and cognitive behavioral therapy are all proven methods to reduce stress. However, one of the foundational management strategies for chronic stress is mindfulness meditation. Mindfulness meditation teaches individuals to be actively in tune with the present moment. This includes interacting with the input and stressors that are happening right now. By focusing on the present, people can learn to be intentional in the way that they respond to stressors without the interference of previous worries or anxiety about the future. Through mindfulness meditation, participants learn how to observe their thoughts and feelings from a distance, allowing them to watch them, but choose whether or not to engage with them. Overall, mindfulness meditation can help train one's mind to maintain a sense of calm in the midst of daily stressors. Research has shown that mindfulness meditation can cause a statistically significant decrease in systolic and diastolic blood pressure, a change that was not seen in the control groups of these same trials. Some research has found that even one session of mindfulness meditation can lower systolic and diastolic blood pressure in a measurable way immediately after the session ends. Additionally, the study found that the more consistently mindfulness meditation is done, the longer the effects last after each session. Mindfulness meditation is a primary prevention strategy for hypertension. What that means is that it can be employed to protect the individual from developing hypertension. Mindfulness meditation can also be used as a secondary intervention. That means that it can help lessen the symptoms and improve outcomes when hypertension is already occurring. My family has a history of hypertension, which has led to heart disease, heart attacks, and stroke. In developing this program, I researched many behaviors that would help to prevent the development of high blood pressure and support symptom management if I did develop it. Furthermore, I undertook this program in my own life to understand the effects that it would have. I will talk in more detail soon about my experiences with this program. The Hypertension Prevention Program is designed to assist individuals in learning how to approach stress differently through the practice of mindfulness meditation. The goal of this program is to decrease systolic blood pressure and diastolic blood pressure. It does this by giving you tools to manage the chronic stress that we have learned can significantly contribute to hypertension. In addition to hypertension prevention, this program may also help to manage or reduce the symptoms of anxiety and depression that can detract from overall quality of life. This program was created for adults ages 18 to 65 with a family history of hypertension. However, people of all ages can participate and find use and meaning in the exercises. The program is designed to last 8 weeks in order to experience the full benefits of meditation. It is encouraged to continue meditating daily after the program concludes in order to continue reaping the benefits of meditation in the long term. Whether or not you choose to incorporate meditation into your life after the program is up to you. However, it is important to commit to the full 8 weeks to begin. During the hypertension prevention program, participants will engage in daily mindfulness meditation. For the first 4 weeks of the program, we will focus on meditating for 10 minutes per day, increasing to 20 minutes per day during the second 4 weeks of the program. Guided meditations are encouraged using any of the online or phone-based meditation apps. A list of suggestions can be found in the last slide of this presentation. Participants can choose what time during the day works best for them to meditate. However, it is recommended to pick a time that makes sense and stick with it for the program. It can be helpful to add meditation to a pre-existing habit. This proven behavior change tactic is called habit stacking. Examples of this could be meditating right after you brush your teeth in the morning or right after putting on your pajamas at night. The idea is that by adding a new behavior onto an already existing habit, it creates a cue to remind you to do the new behavior. It might require trying a few different times of the day to find what works best for you, so feel free to play around with this for the first week of the program to determine what is best. No special equipment is needed in order to meditate. However, it is best to find a comfortable place to sit in a quiet room or corner. If desired, feel free to meditate lying down, as long as you are not in danger of falling asleep while completing the practice. For the duration of the 8 weeks, we ask that you keep a journal to track your daily meditation as well as the effects it may have on your life. In addition to checking off daily that you completed the meditation, you will track how many hours you slept the night before, and you will also rate the following factors on a 1 to 10 scale, with 1 being low or undesirable and 10 being high or optimal. You will track mood, patience, focus, anxiety, and sleep quality. Finally, in this journal, please feel free to write down or track any other changes you might see in your life. Journaling has been shown to increase adherence to behavior change programs, as well as providing small wins that keep you motivated to continue. According to BJ Fogg, tiny wins are an effective way to motivate us to continue making behavior change. Every time you check the box that you meditated that day, your brain activates the reward center and craves doing it again. So go ahead, make it fun, and give yourself these small rewards for every little step that you take. This journal will also be indispensable at the end of the program to see the effect that mindfulness meditation has had on your life. During the 8 weeks of this program, the group will meet virtually every other week to check in with each other to discuss how things are going, celebrate successes, and discuss any issues we are encountering. This meeting is a very important component of the program. Several studies have shown that social support is one of the most significant ingredients in successful behavior change. This is not only because it keeps us engaged in the program and motivated in our behaviors, but also because knowing other people are there for support and commiseration is a powerful tool. We thought long and hard about this part of the program because we didn't want this step to be the barrier to entry for participation. However, the benefits of including this social component outweighed the potential scheduling complications. The compromise is to make the meetings virtual so that physical attendance is not required. As this program is aimed to reduce blood pressure and prevent hypertension, we will also take blood pressure readings at the start of the program and again at the end. Mindfulness meditation is a proven primary prevention strategy for hypertension. However, there are other lifestyle factors that also contribute to the development of hypertension. These include, but are not limited to, diet and exercise. In order to reap the optimal benefits from this program and do the most to prevent hypertension, you are encouraged to incorporate eating a balanced diet and engaging in 30 minutes of physical activity daily into your routine. For more information on how to eat a balanced diet, we recommend visiting the USDA's MyPlate website for information, resources, recipes, and diet tracking tools. For help creating a daily activity routine, please check out the CDC's Physical Activity Guidelines and Suggestions. As I said previously, over the last several weeks, I have begun including a daily mindfulness meditation practice into my own life, and I was surprised by the results. I found that I have better control over the effect my stressors had on my body and mind. and because of this, I had better control over my blood pressure. Through mindfulness meditation, I learned to view stressors from a distance, allowing me to choose if and when I engaged with them, or if I let them just go by. This gave me a greater sense of calm that was not easily ruffled by outside events. I found that I was more patient with my children, more focused at work and in my schoolwork, and that I was better able to turn off my anxious mind when it was time to go to bed. I do not currently suffer from high blood pressure. However, when I experimented with taking my blood pressure before and immediately after a meditation session, it dropped in a measurable way. For ideas of guided meditations to choose, please see this list. Pick whichever option makes the most sense for your budget and digital capabilities. Through the process of this project, I have identified several behaviors I would like to take on, while also becoming more realistic about what is needed to achieve behavior change in my own life. One of the items that my partner highlighted during peer review was the lack of attention paid to the need for social support. As we have learned, social support is a significant factor in long-term change. In the first draft of my presentation, the hypertension prevention program through mindfulness meditation did not have a social component. My partner brought this to my attention and asked probing questions about how social support could fit into adherence to the program and into creating lasting change. This was much needed feedback and also drew my attention to the piece of my personal behavior change that was missing. I am often uncomfortable asking for help, even when that help is in support of a beneficial change. In my own practice, my most significant barrier was not having time to myself to meditate. I struggled to ask for support to create that time and did not nurture motivational support to keep me going. For my presentation and for my personal behavior change journey, my partner's suggestion of making social support a priority was a much needed addition. For more information, please see these references.